We can have all sorts of discharge coming from your nipple. Some indicate that it could be a cancer. Others are benign conditions, meaning that they are not cancerous.
Okay.
For example, you have clear discharge from the nipple.
Okay.
That's just like water. Most of the time, it's a benign condition causing it. But if you have discharge from the nipple that is bloody, 2022 or 2020 there around, you get every year about 2.3 million new cases of breast cancer
Whoa.
annually. Okay. So if you realize your nipple all of a sudden is looking smaller than the other one, meaning it's retrieving, it's getting back into the breast, then it's a sign that you should let a doctor assess and see. And you know your breast well. The moment there's a change, you'll be able to pick it up that, oh, my breast, one now has become bigger than the other. Or when I touch, I feel that there's something inside it. But if you don't do the examination yourself every month, then it's difficult to pick up the changes when they do occur.
Okay.
So we advise that once you hit 20, try as much as possible and do the self-breast examination. When we are looking at the symptoms, the breast cancer symptoms, though the lump seems to be the one that catches most people's attention, we have other symptoms that people ignore.
Okay.
For example, you can have just an itch.
Welcome to the Heartbeat Podcast Show, where we talk about health, well-being, and lifestyle. At the Heartbeat Podcast Show, where we are going to have an honest conversation about how we should live our lives in terms of health, from healthy diet to life choices and life situations that will bring us good health and good lifestyle. My name is Dr. Nanaja Konedijani, and I am your host. Today, I'm happy to have with us Dr. Emmanuel Nashele, Head of Surgery at the University of Ghana Medical Center, UGMC, as we all love to call it. And it's an honor for him to be my first host for the Heartbeat. Heartbeat Podcast Show, we say it's one heartbeat at a time. Dr. Nashele,
Yes.
you're welcome.
Thank you very much, Manager.
Okay. Today we are going to talk about breast cancer. We have to know all what it is you need to know about breast cancer. Dr. Nashele,
Yes.
there are a few questions that people keep asking when we talk about breast cancer. And today we want you to explain to the whole world, everybody who is watching us, on what exactly breast cancer is. When we say breast cancer, what is it?
Okay. Breast cancer, just like we talk about all cancers, are abnormal cells that are growing in your breasts. So usually you have changes happening in every part of your body as you grow. And these changes are regulated, they are controlled, so that you don't have one part of your body being bigger than the other part. Okay, there are mechanisms that are responsible for controlling the growth of the body parts. When these mechanisms fail to work well, then you can have a part growing abnormally. And when that happens in your breast,
Okay.
then we say that you have a breast cancer. And we need to look at it and see how it can be solved. It's not every growth in the breast that is breast cancer. You can have abnormal growth in the breast, but it may not be breast cancer. Okay. So, though we say growths in your breast can be cancerous, don't be afraid, in the sense that majority of the growths in the breast are not cancerous. They are abnormal cells yet, but they are not cancerous.
All cancerous.
Yes.
Okay. All right. So, why is it important to detect it early? Because this year's theme is saying that detect it early, treat it right, and survive it. Why is it important? Why is it necessary for one to detect the breast cancer early? And if it is so, how would one detect it early?
Yes, so the team detecting it early is important in the sense that in our environment in Ghana, we have realized that up to about 70% of women with breast cancer come when it has already spread.
Okay.
And usually when you come in that stage, the treatment options are limited. It's difficult to treat the disease or cure it when you come at a stage where it's already spread. But getting it early, once you detect it early, your options are many. And the chance that you will live without the cancer is very high once you pick it up early. The chance that you lose your breast is small when you pick it up early, because the very early ones, we only deal with the lump. We don't remove your breast, as most women are afraid that, when they are diagnosed with breast cancer, they will lose their breasts. If you pick it up very early, it's possible your breast will not be lost. We only handle the lump, and then you go through the rest of the treatment, and you live your life free of breast cancer and die from something else and not necessarily breast cancer. So it's very important that you pick it up early.
Talking of the treatment, so are there stages? Because we know that when it comes to cancer, there are stage 1, stage 2. Is it the same with breast cancer as well? Are there stages? And if there are stages, could you briefly explain what the stages are and what it means for a patient to know that I have to go early so that I don't get to this stage that can cause the total removal of the breast or loss of the breast? Are there stages when it comes to breast cancer as well?
There are stages in breast cancer, just like we have in every cancer.
Okay.
And broadly, I will divide it into two, just for easy understanding.
Okay.
Because what you hear most often is maybe stage 4 or stage 1 disease, stage 2, stage. So we have it 1, 2, 3, up to 4.
Okay.
But what nobody wants to hear is that I have stage 4 breast cancer, or any cancer at all that you have stage 4. When we say stage 4, it means that the cancer has actually grown out of where it's supposed to be. The breast, if we are talking about breast cancer and we are talking about stage 4, it means the cancer has grown outside the breast. Okay. So it has spread to areas outside the breast. And when we say areas outside the breast, we mean it's probably spread to your bones, it's spread to your chest, the lungs, it's spread to your liver and other areas. So anytime you hear about stage 4, it means that the disease has gone out of where it's supposed to be, or where it actually started from. But when you talk about stage 1, stage 2, those are early cancer stages that usually are still confined to the area where the cancer is. And once a cancer is still confined to where it started developing, it means that you can get rid of that cancer and cure the person. Okay. So stage 4 cancers, you can't cure them. They have gone out of reach. Okay. We only manage to improve your quality of life. Okay. That you are having, your blood level is low, we give you blood to support you. You are having difficulty breathing, we give you oxygen to help you breathe. You are having pain, we give you pain medicine to alleviate the pain. But to get rid of the cancer itself, it is impossible when it has spread outside the area where it started developing. So stage 4 cancer means that it spreads, and that's very difficult to handle. But the early stages, stage 1, stage 2, those are cancers that you can actually cure.
Okay. saying that it's not all lump that is cancerous in the breast, and also it's not all breast cancer that will cause somebody to lose their breast. So please, when you develop a lump, please detect it early and then take the necessary steps. Before I go on to further questions, I would like to still acknowledge my sponsors, and that is Adenta Credit Union, Thyroid Ghana Foundation, Tulipa, Akuma Productions, and also it's also brought to us by the University of Ghana Medical Center Department of Surgery, UGMC. Thank you very much, Dr. Nashili. I would like to know, do men also at risk when it comes to breast cancer?
Yes, we have seen men with breast cancer, even though it is not as common as we see in women. If you take 100 people with breast cancer, 1 out of the 100 will be a man.
Okay.
So you have about 99 of them being women and 1 being a man. So we always say 1% of the cases we see in men. So it is something that is not very common in men, but some men come with breast cancer. The unfortunate thing is, because men believe that they don't have breasts, when they feel there's a problem, they ignore it.
Okay.
And most of them will come when it has spread. So it's important for men to actually also take good care of their breast and report early when they notice changes in their breast or the nipple in particular.
I see.
Thank you.
All right. And at which stage should one pay attention when it comes to examining the breast? At which stage, in terms of age-wise, at which stage should one pay attention when it comes to examining the breast to see whether there are lumps growing or anything like that? At what stage?
So we say early detection is important. We say, how will you detect it early if we don't have ways of picking them up? And the ages when we should start screening varies from country to country in particular, but worldwide, or in what is in what is common, the common age that we usually use is, we say at 40 you should start screening actively, especially with the mammogram.
Okay.
But it doesn't mean that in our country, for example, in Ghana, we've noticed that the breast cancer peaks at 2 different age ranges. And the early one is in the 30s.
Okay.
Averagely around 35.
Okay.
So in Ghana, we encourage all those in the 30s to start actively screening.
Okay.
You see, if you have risks of breast cancer in your family in particular, we still lower that screening age to the 20s.
Okay.
Okay. Recently, I saw a young lady, 22 years old, that had a lump in the breast taken out at one facility, which they didn't think it was cancer. But when it was sent to the lab for examination, it came out that it was cancer.
Okay.
She's just 22 years old. So it tells you that if the risk factors are there, if in your family you know that breast cancer is there, you should start your screening much earlier than the 30s that we talk about in Ghana for most women.
Okay.
So once you know that your mom had breast cancer at an early age, she was 30, she was 35 when she had it, you should start your screening as early as 20. And the screening methods are many. Okay. So we say the self-breast examination is the first that every woman should do.
Okay.
Once you start menstruating, once your breast starts developing, it should be possible for you to check every month.
Okay.
If your breast is okay. If you look at it, and you know your breast well, the moment there's a change, you'll be able to pick it up that, oh, my breast, one now has become bigger than the other.
Okay.
Or when I touch, I feel that there's something inside it. But if you don't do the examination yourself every month, then it's difficult to pick up the changes when they do occur.
Okay.
So we advise that once you hit 20, try as much as possible and do the self-breast examination yourself. Then you can do ultrasound.
Okay.
The ultrasound we do more for those who are less than 40.
Okay.
Because when the breast is still very dense, mammogram will not be able to pick up anything.
Okay.
So for those below 40 years, you can do ultrasound if you want to be sure there's nothing in your breast. You can touch the breast, examine, and not find anything, but the ultrasound will find something small in it.
Okay.
So if you are still very young, cancer risks are not high in your family, you can decide to do an ultrasound of your breast once every 2 to 3 years, just to be sure that nothing is developing in your breast. But if the risk is high, then you should be doing the ultrasound scan at least once a year. Okay. Some people will do it even twice a year just to be sure that they don't have anything growing in their breast. If you rely only on the examination, the lumps, we say we can touch the lump when the size is about 2 centimeters. Okay. When it's less than 2 centimeters, a 1 centimeter lump, your hand may not be able to feel it. Okay. Even the doctor will examine and not be able to feel it. But when the scan is put there, they'll be able to see that, yes, there's something in the breast. And they can look out. We can do other things to find out whether it is cancerous or not.
Okay. Look, on the examination, apart from the lump, is there any other thing else that one can see? Let's say maybe can the breast color change? Anything apart from the lump? Because we mostly focus our attention on looking out for a lump. Is it all of it that comes with a lump, or some will start with maybe the color change of the skin or something like that?
Yes. So when we are looking at the symptoms, the breast cancer symptoms, though the lump seems to be the one that catches most people's attention, we have other symptoms that people ignore. Okay. For example, you can have just an itch around the nipple, and it looks
itching. Like it's itching you.
Itchy,
okay.
Like eczema.
Okay.
On the nipple that is ignored. But that can be the beginning of breast cancer. It can be the beginning of Paget's disease, which is a precancerous state that later becomes cancerous. So, yes, changes in the nipple alone or itching that worries you around your nipple area can be a sign that you should get a doctor to examine and assess and be sure that it is not something that can later become cancerous. Okay. There's other skin changes. You can have swelling. The swelling, yes. If you notice that, yes, one breast is bigger than the other, yes. But if you've noticed any reddening around the skin of your breast at any point, you should let a doctor see. The swelling, the reddening most of the time can actually be from inflammatory causes. Let's say, when we say inflammatory, it could be an infection. Okay. You have somebody who is breastfeeding and he notices reddening around the breast. Majority of the time, it's just either mastitis, which is an inflammation in the breast, or probably an abscess from like a boil, sort of. Okay. Those ones are all not things that you should worry so much about because they are not cancerous. It's just an infection process that can be treated with antibiotics most of the time, and it goes away. There are few of them that you can have that reddening, and then we do the investigations and then later find out that it is cancerous. So because you don't know which one it is, anytime you have a color change in the breast, try as much as possible and let the doctor have a look. The nipple can also actually change in size.
Okay.
Your nipple can retract. And when we say retract, it means it moves backwards.
Okay.
So if you realize your nipple all of a sudden is looking smaller than the other one, meaning it's retrieving, it's getting back into the breast, then it's a sign that you should let a doctor assess and see.
Okay.
Then the discharge. We can have all sorts of discharge coming from your nipple. Okay. Some indicate that it could be a cancer. Others are benign conditions, meaning that they are not cancerous.
Okay.
For example, you have clear discharge from the nipple.
Okay.
That's just like water. Most of the time, it's a benign condition causing it.
Okay.
But you cannot be sure. When you come to the hospital, we do the test that we have to, the scan, and sometimes even take that discharge to the pathology lab for cytology. To do all that, they tell us that, oh, it is not cancerous, and then we leave you alone. But if you have discharge from the nipple that is bloody,
okay,
yes, it's a worry sign, and that you need to have it checked as early as possible. So bloody nipple discharge can be a sign of breast cancer, and if you are having that, please, as early as possible, seek a doctor's opinion about it. So the signs of breast cancer or symptoms are many. Okay. There are a lot of them. The other one in advanced stage is the orange peel appearance.
Okay.
You know, you have so many dimpling areas within your breast. The breast just looks like how the peel of an orange looks.
Okay.
We see that more in the inflammatory breast cancer and also breast cancer that is in the advanced stage. Okay. So the person has a lump for a long time and now it's infiltrating or involving the skin. Okay. Then you see that the whole breast just looks like an orange peel.
Dr. Nashele.
Yes.
It's sometimes you'll be looking for globally statistics about the numbers. You check for research work done and all that.
Yeah.
So I want to find out, what is the global outlook like for Ghana and Africa? Is it too much? Is it increasing, or is it at a minimal? What do you see for the let's say for the last 5 years? How has it been like?
Yes, we look at, let's say, how common we diagnose breast cancer recently. We look at the number of women that usually are involved. So if you look globally, they will tell you that from 2022 or 2020 there around, you get every year about 2.3 million new cases of breast cancer.
Whoa.
Annually. Okay. In Ghana, we are recording at least 5,000 new cases annually.
5,000
new cases of breast cancer annually.
Not those that had been seen already.
No,
new cases.
New cases annually.
I see.
You are getting that much every year.
And how does it look like? How does it come? Early stage, latter stage?
So that is why we are having this awareness creation, because we have noticed that these new cases that we get, more than 60% of them come in stage 4.
Gosh.
Okay, so if you have a society with this level of burden, that majority of the cases you are seeing, you can't help them, or you can only offer minimal help. That's the supportive treatment.
Yeah.
Then it calls for worry that you need to improve that outlook. We need to let people understand that they should take good care of their breast. They have any small problem with the breast, they must go to the hospital. And we also need to let our pastors and fetish priests and the traditional healers, and you see, many people who want, when they have a problem, they want to go to either the pastor to pray over it or go and seek.
As Africans and Africans.
Yes. And it is part of the reason why we don't get them early.
Okay.
Because I have seen people coming to me from traditional healers that they were at the camp being treated, then they realized that
It's not going.
or he needs blood.
Oh.
And the traditional healer says, go to
Hospital.
they give you blood and you come back. And when they come back, when they come to the hospital and you want to talk to them about the fact that this is not something you should stay at,
Traditional.
the traditional healer, they will not understand. So we need to get people to understand that our health-seeking behaviors need to change. You can see a pastor to pray over you. You can still go to the hospital at the same time and hear what the doctors have to tell you about your problem. And you see, if you don't even know the extent of your problem, even when there's a miracle coming your way, you cannot know.
Of course, you won't see it.
Okay, because the doctor needs to tell you that you have breast cancer.
Yeah.
And then you go back to your pastor to pray over you. And then you come back to doctor and doctor checks and tell you that, oh, your breast cancer is gone. Then
So
you can realize
know
that
the prayer worked.
Your prayer really worked.
Yeah.
But if you don't combine and you are only at your pastor's place or the traditional healer, and at the end of the day, when you are now at the terminal stages, then they say, go to the hospital. They come to the hospital and they die, and they only add up to the problem because now the daughter of that woman or brother or sister says that my mom was fine until he went to the hospital and then he died at the hospital. Then it now looks like it is the treatment at the hospital that was no good, and that's why the person died. But the person only went to the hospital when they couldn't do any other thing for the person.
Okay.
So when they come and die, they just make things worse for us. People don't want to come to the hospital because they think that when they also come, the same thing will happen. Die. But that is because they come late. So if you come early with your disease, as we have a lot of survivors who have had the breast operation and gone through all the treatment, and they are living, okay? I had a nurse in one of the hospitals that she actually had the two breasts both out now because she got breast cancer in one. We did a surgery for her. She went away. 5 years later, when she came, the other breast has also developed a lump. Yeah. We investigated, it was the same thing. Both breasts, she doesn't have. 10 years now, she's living her life without. Nobody knows because we still give you things that you can wear and dress up like a woman and go about your normal business. You have life.
Yeah.
But if you don't pick it up early, then that's where the problem is.
Yes. With this one, I'm adding up every day or at least once a week. Stand in the mirror and then self-examine your breast. Have a total look at your breast to see. It's only when you pay attention that when the changes are happening, you know. Don't wait for it to become a discharge to become bloody or anything of what he had mentioned before. And if you see any changes at all, please, please, and please. Yes, he's mentioned before you go to your pastor, please seek health professional advice first. Go and see the doctor and let the doctor tell you. Let them do their investigation as you pray. So go to the hospital. Let the hospitals do what they have to do. And let your pastor also back it with prayers. Because as he mentioned, until the doctor tells you you have this condition, for your pastor to pray, for you to come back, for the doctor to rerun and tell you that your disease is gone, you won't even know that miracle has happened. And I really agree with that. So please, let's take this seriously. Dr. Nashele,
yes.
Aside some of the few things you've mentioned, like the mammogram, the ultrasound, the normal examination, there's something that people say it is called biopsy. Yes. Can you please zoom into biopsy and when biopsy is needed?
Okay. So the biopsy just means taking a little bit of your lump that is detected in the breast, sending into the pathologist to look under the microscope and tell us whether that lump is cancerous or is non-cancerous.
Okay.
And we have different types of biopsies that we take.
Okay.
The type of biopsy we take depends on what you have. So let's say a young lady comes with a breast lump and she's 20 or 18 years old, let's say 18 years old. And then I have spoken to her to find out the risk factors, and she doesn't have risk factors for breast cancer. So we do the ultrasound, and ultrasound tells us that this is likely non-cancerous, or it's BRCA2 or BRCA3. So with that, if our examination is also telling us the same thing, that this is not likely to be a cancer,
Okay.
the biopsy we'll do will be just taking the lump out
Okay.
and sending the whole lump to the lab for them, the pathologist, to look at. But if the same lump, somebody 30 years old, came with that same lump in the breast, and he doesn't even have the risk factors. But because we know in our system in Ghana, we have a lot of people with breast cancer in the 30s. That lump, we are not likely going to just remove it right away, because also if you remove the cancer, you remove a lump that is cancerous, you can actually change the treatment modalities.
Okay.
So we always want to be 100% sure that it is cancer or not cancer before we go ahead with the treatment. So somebody in the 30s with a lump in the breast, we don't remove it outright. No.
Okay.
First, we will use a small needle, okay, just to take, and it's not a painful procedure.
Okay.
We numb the area and pass a small needle, to take a few bites from the lump. Now send it to the pathologist to look at. The pathologist will tell you it is not cancerous. Okay. Then you can now go and remove it peacefully.
Okay.
But if the pathologist tells you that it is cancerous, then that person goes through the counseling and the treatment modalities for breast cancer. That is the second aspect, that you can use a needle, just a needle. And the needle, we have different sizes. We can use just the normal needle to take one cell and do the test on it, or a bigger needle that can take a chunk of tissue and send for the histology. Then the other aspect is for people who come to you already with sore on the breast.
Okay.
So for those, instead of using a needle to take the sample, we can just use the surgical blade, our small blade, to cut just a little bit at the edge of the sore, and take that to the lab and they examine it. It's also a biopsy. So that one is an incision biopsy, and they will tell us also from that report as to whether it is cancerous or not cancerous.
Okay.
So as I have said, I've given about at least 3 different ways by which we can get sample to the lab to test. And it all depends on the stage at which you come, or the age at which you present to us with.
Okay.
And usually it's not a painful procedure at all. And in Ghana now, if you send the sample to the lab within a week, in fact, some histology labs can give you results within 3 days.
Okay.
So within 3-4 days, you get to know whether what you have is cancerous or is non-cancerous.
Okay. All right. You mentioned the ultrasound, the mammogram, the MRI, what we just taking the tissue to do the biopsy.
Yes.
I'd like to know, how widespread is this service in Ghana? Is it widespread? And if it's not, what should policymakers hear about this?
So in Ghana now, the imaging modalities, that's the scans, ultrasound, mammogram, CT scan. Ultrasound is available almost everywhere.
Okay.
Almost every district hospital in Ghana, you can get an ultrasound to do.
Okay.
CT scan is most of the regional centers that have it.
Okay.
But when it comes to the biopsies, a lot of doctors in the district hospitals can take the sample. The pathology services may not be readily available at where they are taking the sample.
Okay.
But when they take the sample, for example, I've worked in Volta region before, and we don't have the pathology services in Volta region.
Okay.
But we take the samples and they are transported to the pathologists in Accra. They do the test and bring the results back to Volta. And all that process can take within a week.
Okay.
Sometimes even they mail the results to you instead of sending you hard copies.
All right.
So there are areas where you may not be able to have the pathology services, but the sample can be taken so that the lady who had a breast lump in Aflao will not have to move all the way to Accra. No, there are doctors in Aflao District Municipal Hospital who can actually take the sample and then send it to Accra, and the results will be done. The results, the histology will be performed, and the results sent back to them.
Okay.
So, for the ultrasound is everywhere. Okay, CT scans most often at the regional centers or regional capitals. You get CT scan done. The biopsy, most district hospitals have doctors that can take the biopsy, and then it's sent to a pathologist to examine. So, its access is not a problem.
Okay.
It is readily available.
All right. So, we've all heard that we have all these accessible to us. So please, it means that we have no excuse not to have this done annually. So if you are above, as he's mentioned, 30 years, that is if there's no family history. But if there's family history, as he said, he's seen somebody below the age of 30 having it. If you have a family history of breast cancer, please, annually, please do your checks so that early detection will save you a lot from all the things he said, you being given a comfortable thing. And if it had been cut early, the treatment modality would have been different. So this is for all of us. And Dr. Nashele, please, before we go on and before we have a conclusion, I would like you to talk about what the University of Ghana Medical Center, Department of General Surgery, is doing for, we heard there's a screening ongoing. I'd like you to talk about it so that people listening to us will know if they go to UGMC what they can or be seen or offer.
Yes, so for the month of October, the Pink October month, UGMC is offering free screening services to the public. And we've taken Wednesday as the day for this free screening. So anyone who is interested in doing the screening, you can come to UGMC on Wednesday.
Every Wednesday?
Every Wednesday in October.
Okay, that's good.
So if you come, the screening is free. The imaging, that's the ultrasound and the mammogram, you will be charged about 50% of the normal price during this month of October. The offer only is limited to the Pink October month. And so we are encouraging people to come and get screened. It is important that at least if you haven't done it before October every year, you should take the opportunity available and then have your breast screened.
Good.
So it's important that people come around. We will examine you, we talk to you, and then if we think you need a mammogram or the ultrasound, we request it, and then you pay half of the price.
This is Don't Call Me. Half of the price at UGMC, the ultramodern hospital in Ghana, so far. So as Dr. Nashele had told us, University of Ghana Medical Center, every Wednesday throughout this month of October. So this week, tomorrow is a Wednesday. Today is any Wednesday, any week within the month of October, that is a Wednesday. Just go to UGMC the whole day. Or it's not the whole day.
It's usually we start at 9
a.m.
and end around 4 p.m.
So 9 a.m. to 4 p.m. Go and have the counseling, have the exam, free screening, and if there's a need for you to do any of the tests he's mentioned, the ultrasound, the mammo, and whichever one, then it will be requested for, and you're paying half of the amount. So just take advantage of this and then go and have it done, so that if it's detected early, we treat it right, and then you can survive it, to prevent it from it being spread to, and then for you to lose your breast, which is the scary part why most people are moving away or staying away. But if you stay away when you have seen any changes in your breast, then you are putting yourself at risk. So please, let's not put ourselves at risk. This episode of the Heartbeat Podcast Show is brought to us by the Thyroid Ghana Foundation, Adenta Credit Union, Building Dreams Together, the Salt Power, Smart Online Shopping, and then the Tulipa 365 Hair and More, and the 1115 Restaurant. Eat right, relax, and connect. And as well as by the Akuma Productions, where you have all your production needs attended to. You need to please take the Pink October, the 50% off, take advantage of it at the University of Ghana Medical Center. So the breast screening is every Wednesday in October. If you need to call, there are call up there. You can check the University of Ghana Medical Center website for more details. Before Dr. Nashele, we hand over, we're going to mention the numbers that you can call so that you can arrange also for you to be seen. And this is every Wednesday in the month of October from 9 a.m. to 4 p.m. at the University of Ghana Medical Center. Please take advantage of it. My last question, Dr. Nashele, before we wrap up. There's what we call the BRCA gene, right? The BRCA gene. People talk about it. Somebody will tell you that, they said that my family, we have that kind of gene. What is it about?
Okay. So there are two genes that are usually associated with breast cancer that we hear commonly. And that's the BRCA, which we usually say BRCA. BRCA1 and BRCA2. So the BR is just breast cancer. BR is BR for breast, the CA for cancer.
Okay.
So it's breast cancer gene 1, breast cancer gene 2. These, under normal circumstances, the breast cancer is about 80 to 85% not associated with hereditary.
Okay.
Only about 10 to 15% are hereditary. So when we talk about the hereditary one, it is the ones that these cancer genes, the BRCA1 and BRCA2, are seen. Under normal circumstances, these genes that I mentioned are tumor suppressor genes. When we say tumor suppressor genes, a tumor is a growth. So they are genes that suppress or decrease the growth of cells rather. They actually rectify any change in your DNA. The DNA is like the brain, the engine behind cells growth in your body. They are proteins that usually are responsible for the growth of cells in your body. These genes actually regulate that to ensure that the cells do not grow out of proportion. So they suppress the growth of tumors. Unfortunately, when you get them being mutated, and mutated means that changes occurring in them. When you have changes occurring in them, then they fail to regulate this tumor suppression. They are unable to control the growth of the cells any longer, and so the cells just grow anyhow. And then it becomes cancerous. So we have tests for them. If you think that your family, you have a high risk of cancer, and you see they are not only associated with breast cancer.
Okay.
These genes also are seen in ovarian cancer.
Okay.
And even prostate cancer.
All right.
So if your father had prostate cancer, or there is a family history of prostate cancer, a strong family, so many males in the family are having prostate cancer, it is possible this gene is in your family.
Okay.
You can test for it. It's available. The tests are available in Ghana. It's just that it's a little bit expensive. Average is around 4,500 or so.
Whoa.
To know if you have the gene in you or not. Okay. But if the risk is high, it's worth it that you test. You test and see. If you test and you realize that you have the gene, it still doesn't necessarily mean that you will develop the cancer. Even those with the genes, we say up to about 80% of them may develop the cancer.
Okay.
20% will not.
Okay.
But it's worthwhile knowing that you have the gene, and if you have it, because the risk of you developing cancer is high, then you can do something about it. So the BRCA1, BRCA2 are tumor suppressor genes, but when you have changes in them, that's when they are mutated. Then they allow cancers to grow in us. And if you think your family, there is that risk, ovarian cancer, prostate cancer, breast cancer, the chances are high in your family. It is good to have this done. The test can be done for you. And if it's picked up that you have it, then you can plan your life in a way to even ensure that you don't develop breast cancer. Because assuming you get to know at the age of 18 or 20 that this gene is in your family, your life can be modified. You can decide that, I'll marry early, have my kids, and by 30, I do prophylactic mastectomy. I remove my breast at the age of 30.
Okay. So
and then do breast reconstruction to have your breast remolded for you, but the breast tissue itself is taken out so that it minimizes your risk of getting the breast cancer. Okay. So it's good to know if you think the risk is high in your family, and it can change the way you do things. Okay. As I said, you have your kids early and take your breast out and have your breast reconstructed, and you still live a normal life without getting the breast cancer.
Okay, so this is for those of us who think that we have a family history of breast cancer, the BRCA genes. Let's have a test so that we know how to live our lives. In general, our lifestyle choices such as diet, alcohol, stress, and all the rest, do they play a role in the development of breast cancer in any way?
Yes. And it's not just breast cancer, but most cancers.
Okay.
Stress, you see, when you are stressed, the hormonal changes in your body are different. Okay. Okay. And these hormones regulate most of the genes we talk about. So it even impacts their lifestyles. People get stressed, and for that reason, they drink alcohol, which will cause trouble for them. People get stressed, and for that reason, they eat anyhow, just because of the stress. Yeah. So they put on so much weight. And the moment you are obese, you know that your risks for medical conditions are higher. Aside cancer, you have diabetes and all other sort of things that can worry you. So stress plays a vital role that we try as much as possible not to get ourselves worked out, stressed. You reduce stress, you lead a healthy life by eating. You see, a lot of fruits and vegetables are protective. Yeah. Which also is not frequent in most diets. Many people do not like to take fruits, do not like to take vegetables. But this actually prevent us from getting cancers. The sedentary lifestyles we have, that we don't want to walk, we don't want to exercise, and every day we are sitting down at one place at most times. it doesn't help. People who exercise actually don't develop as many cancers as those that do not exercise. So healthy living is part of the prevention for cancer. That try as much as possible, eat responsibly, exercise, and limit your stress levels as much as possible. And this can help you live without cancer.
Okay. Now, your final words.
The theme for the celebration this month is detect it early, treat it right, and survive it. And we still will emphasize that people take care of their breasts. At least if you've not been minding your breast this month, please give it attention, examine yourself, get to the hospital, let us screen you, and be sure that your breast is healthy. Because as we say, if we are able to pick up anything early, then your chances of living without breast cancer is very high. Don't wait until it's too late. Okay, at least October is the month for breast, and it is important you get your breast check this month. Thank you.
October is the month of breasts and it is important. So, men and women out there, men, please push the women to go and have a check. Women, please push the men, because we've heard that breast cancer is not only for women alone, it's for both men and women. So please, let's be each other's keeper and let's push each other to go and have a check. Early detection saves lives. And this episode of the Heartbeat podcast, which is our very first episode and happening in the month of October, the pink October, and my month of birth. I'm so excited when it's October because I know that my birthday is coming and my year is beginning. And this episode is brought to us by the Salt Pal Smart Online Shopping, Tulipa 365 Hair and More, Adenta Credit Union, Building Dreams Together, the Thyroid Ghana Foundation, which championing the thyroid health and thyroid awareness, and also advocacy for thyroid treatment throughout the country and beyond. And also 1115 Restaurant, Eat, Relax, and Connect. And finally, by the University of Ghana Medical Center, the Department of Surgery. Our guest has been Dr. Emmanuel Nashele, Consultant General Surgeon at the Department of Surgery, University of Ghana Medical Center. And I am your host, Dr. Nanaja Kunedu. It's been a good day to have you, Dr. Nashele. Thank you for coming.
Thank you very much.